I'm curious, and I'd love to have either of your perspectives when you are, advocating for Medicaid expansion in the state. And I understand all the reasonings and everything that you're saying. But then earlier this morning, we heard about, the kind of the changes in the 1115 waiver, and we're going to be losing, eventually the DSRIP funding and the possible changes to the Medicaid program, in which it appears some proposals are to push more of those Medicaid costs onto the state. So in light of sort of, I'm trying to figure out, I appreciate your perspective in saying we want to expand Medicaid, but it looks like that on the federal level, we're not anywhere heading towards that direction.
I think predicting or counting on major negative consequences at the federal level, we have to be cautious on that. ACA repeal was attempted 4 times just this last year, and story after story of people losing their health care coverage prevented that. The Medicaid stories are going to be far worse and far greater. Yes, we believe there will be a push at the federal level to continue to try to cut Medicaid, but we think the pushback from states and from people will be large, and we shouldn't automatically assume that will be successful. My other...
Do you believe that HHSC and state leadership are going to agree with you on that? Are going to be pushing back?
Whether they agree or not, I think Texas will put itself in its best position by actually doubling down on Medicaid. Even with the proposals that have been provided in Congress, Medicaid expansion states were going to be better off. So positioning ourselves by taking advantage of federal funds available to us today will position us better for future federal changes. In terms of the DSRIP and the other 1115 waiver funds going away, that is, for us, another very good reason to expand coverage to this population now while we have the opportunity. That is how you build in those DSRIP projects.
And I understand what you're saying, that if we're going to move to block grants, you want to have the highest level of spending now, to pull down, to demonstrate the amount of dollars that you're going to need to pull down. But my concern is that I just see the feds moving away from wanting to dole out those federal dollars. And so does the state get into any kind of trouble, for instance, if we were to expand Medicaid and do all these things, and then the feds are down taking a different path, and we are getting less and less federal dollars that we then have to make up for, right, with general revenue dollars, and where does that money come from?
Well, there's a couple of things. One is, I would say the difference between the kind of DSRIP and, there's people, maybe they're not here anymore, they've left, but people who know more about DSRIP than I do, for sure. But, the story has more been...
And I just said DSRIP is in the sense that that's federal dollars, that are federal health care monies that are going to go away. They're being phased out. So we are seeing there's going to be,
But there's an important difference. And, I think the longer arc of the story from the federal side is frustration with a state like Texas that has so many uninsured people, and we keep trying to do it's sort of anything but actually getting them coverage. So we do these maneuvers to try to get, and that it's not recent. Forever we've been trying, since DISH in the early 1990s. We try to do something other than make the bold claim that people just ought to be able to get health care if they're people. And so you could understand from the federal side how they would be frustrated too. But also from the standpoint of those people who are just people, if they... I think it doesn't sit well with our local communities to say, well, because it's possible that sometime in the future we might have to figure out an alternative, we're just never going to let you have it at all. I think any one of those uninsured people would say, I would gladly trade a couple of years of being able to go to the doctor, being able to get my diabetes under control, being able to get my vision checked and finally get my glasses or whatever it is, even if I thought that in the future it might be hard for me again, it would be worth it to have it for a bit. And I think it would be worth it for you. I think it would be worth it for you all to see a state where so many people who knows what they do, they just don't get care, that to see them being healthy, having jobs, meeting a work requirement because they can work, it would be so worth it to you to see what it would do to your economy, to your local communities, to see that wholeness when today, ever since any of us have worked in public policy, all we've ever seen is Texas is the worst, the worst, the worst. And it doesn't feel like the worst place to us. It feels like the best place to us. So it's very hard to have to keep coming back session after session and hear, well, we just can't, when we know that we just could.
Madam Chair?
Thank you.
May I throw in 2 cents? First of all, I totally agree with Bea and Laura. I'm Dennis Burrell with the Coalition of Texans with Disabilities. Totally agree with Bea and Laura. And I agree, I know where you're getting at. It doesn't look like we're going to have more resources. It looks like we're facing a future of less. I totally disagree with that as any kind of public policy. But there are other voices that are probably going to try to jam this down everybody's throat. There are ways to do cost containment in Medicaid. And I always see it as under 2 general theories, and some of you may have heard me say this before. Number 1, keeping people as healthy as possible instead of letting them descend into sicker and sicker states. Even Dr. Dean from TPPF, who is a friend, I've had a lot of conversations with him, said, well, why don't we do preventative care instead of letting people end up in the emergency room, because we never offered preventative care in our programs. Like dental care is one of my favorites, which, by the way, severe dental pain is always one of the top 2 reasons adults on Medicaid end up in the emergency room. Why? We don't ever clean their teeth or offer them any preventative care. So we're giving our Medicaid population the choice of getting services in emergency rooms or in hospitals instead of keeping them healthy. We could give them access to preventative care. We could have access to reliable attendant care, and I'm going on too long. I know, but you know what I'm getting at is we need to maybe shift things.
Are you trying to say that folks in Medicaid don't have access to dental benefits?
Adults do not.
Yeah.
Literally,
Okay.
Kids do, yes. Adults do not. But adults end up in emergency room because they have abscessed teeth. And then you know what they get? Opioids. And they don't get dental services there. And, just access to therapies for children, early childhood intervention. There's our window of opportunity. If we really rethought these things, yes, we need more resources, but if we're not going to get it, then we better be smarter in how we're planning things out. And the other, I said there's two principles. The other is community, not institutions. And, I like what those guys said at the nursing homes. And by the way, assisted living is considered community care in Texas Medicaid. It's not considered institutions. And I know we have to have that. But if you look at the nursing homes, they have the same Medicaid population now that they did 25 years ago. Now, why is that? Our population has increased. That means our older population is staying at home, even though they got age-related disabilities. So that's proven that we can control cost if we do these things. And if I'm going to throw in my top wasted money approach in our state, our network of state-supported living centers cost a ton of money, serves an infinitesimal amount of people, and is essentially 75% empty. I know this because the population now is 25% what it was in the mid-'90s when we had the same 13 institutions that we have today. So, yeah, I think we need more money, but I think we need to be smarter too, and I hope I didn't use my whole 3 minutes.